Hi there, my name is Dante Yeh. I'm Associate Professor of Surgery at the Ryder Trauma Center at the University of Miami, and I'll be talking to you about utilizing unpaid volunteers. I have to disclose that I receive author royalties for review articles written for Up to Date, and that I've received a research grant for an investigator-initiated trial from Shire. This is the general outline of the talk. We'll divide it roughly into three categories: before they volunteer, while they're volunteering, and after volunteering. And by the way, the advice I'm about to give you can be applied to paid employees for research as well as unpaid volunteers. So, before they volunteer, you are going to want to assess the motivation, and every volunteer that comes to you has a different MO. They run the gamut from high school students interested in being exposed to medicine to physicians from another country who have already completed their training, who are looking to match in the United States. So obviously your treatment of them and your interactions will be different based on their level of experience, but most importantly their motivation. So first of all, I think it's important to understand that not every person who contacts you is going to work out. So a lot of them will have sort of let's say lackluster motivation. So you don't want to waste your precious time in getting too far down the road if they are not going to have the grit to make it through. So one thing that you want to do is you want to sort of separate the wheat from the chaff. You want to see who's really serious and who's just throwing out a net and dabbling. And one way that I have found to be useful is to have them do some training online. So for those of you who are unfamiliar with CITI, this is the Collaborative Institutional Training Initiative. At my institution at the University of Miami, it's required that you receive a training certificate from this online resource before you can be added to any IRB protocol. And so for those of you who are familiar with it, it's essentially, and those who are not, you basically have to take a series of online modules, watch the videos, and then take a test. It's similar to the health stream modules that some of you may have to do for your own institution. Whatever it is, it's super painful, and it takes a while, so it really takes some motivation to complete it. Some institutions have institutional accounts. If you do not, you should. If you're not sure, you should check. But two good modules that I have found to be worthwhile, which everybody should do anyway, is the one on human subjects research and good clinical practice. Now, if you're going to be doing any sort of research, whether it be animal-based research, basic science, or translational or clinical practice, you probably should have a sense of what is good clinical practice and what are the norms for human subjects research. So I generally steer my volunteers to first go ahead and get certified by CITI and send me their certificates. This is a good litmus test to see really how serious they are. Are they motivated? And you'll find that a large proportion of volunteers will simply disappear before they even complete this first task. Now, let's say that they do it. They finish their CITI certification. They send it to you. Now is the time that you can get serious. Now, this is what I want to know. What do you want to get out of this volunteer experience? How can I help you? Are you looking for a letter of recommendation? Are you looking to beef up your curriculum vitalis? Are you looking simply to learn more about the field of medicine, just to get exposed to it? Do you want to learn how to do a Western blot or a chart review? Do you want to learn statistics? All of these questions can be answered by email. So I will generally then say, hey, how can I help you? What are your goals? What's your 1-year plan? What's your 5-year plan? And what's your 10-year plan? Please email it to me. Or if you want to meet them face-to-face, you can do that. And obviously the face-to-face meeting is good because you can look for any subtle red flags that this is a psychopath who's coming to set up shop in your office. And you also want to understand what is their time frame. You know, if they're only going to be with you for a month, for 3 months, for a year, or if they're looking for this to be a permanent position, if they're getting unpaid. I doubt it's going to be permanent, but it's important to understand what your capabilities are and if you can deliver within their time frame. So the advice that I'm going to give you is really relevant to clinical practice, and it's really mainly chart review. I sit down with the volunteer the first time that we go over. I teach them. I say, okay, I want you to review this chart and extract this data. I sit down side by side and I walk them through the process. I do not ask any of my assistants to do anything that I personally have not done hundreds of times myself and could do faster than they can. So I show them my workflow. I do it a couple times, and then I sit them down and I say, I want to watch you do the next few. And so I really just make sure for myself that they're doing it properly, and then I set them on the way. This sort of time investment, it may take 30 or 60 minutes, but it will be well worth your while to make sure that they're collecting data accurately. And then about a week later, I will spy on them and do a spot check, and I'll ask to see their records, and I'll verify and go through and collect it myself, because you don't want to put your good name at risk if their data is going to be all messed up. Another thing that it's really important is these volunteers are relying on you, and we all get inundated with emails, and it's important to make it a priority. Respond to their queries, take a look at their drafts, do it, and so they're not waiting on you, because there really is a power differential here, and you don't want to make them anxious or unhappy with being tardy. So when they're with you, I have found it very helpful to have weekly reports. This helps me keep track of what they're up to, and it also helps them stay organized. Here's an example of one that my research fellow sent to me back in December. So as you can see up at the in the first column, we have the name of the project, whether it's active or inactive. We have a to-do list of what we need to do. We have the IRB status, what's going on there. This enrollment helps you keep track of the overall progress and helps you see like what's going on. Why aren't we enrolling anybody this week? What meeting are we planning to send it to? What's the status of the manuscript, and if they have any miscellaneous comments. So as you can see, I basically do it every week so I can keep track of them. I have them email it to me on a Friday, and I respond by Sunday. After they're done, I think it's important to have an exit interview to get feedback and to learn what's going on. How can I improve? Is there, any advice that you can give us? And so you want to make this as good. You want this to make this a mutually beneficial experience. And for the really excellent ones, the superstars that are going places, I suggest that you sort of keep a file, save a Microsoft document, just put down their contact and check in on them once a year just to see how they're doing. It's really gratifying to see these volunteers, progress in their academic career, and so it's really a source of joy for me. And so that's basically it. I hope this was useful to you. Just remember these things before they volunteer, while they're volunteering, and after volunteering. All right. Thank you very much. Bye-bye.